FASD, or fetal alcohol spectrum disorder, is a collection of social disabilities, learning disabilities, cognitive disabilities, and behavioral issues that develop when children are exposed to alcohol prenatally. For many people, it seems simple that if we didn't have women consuming alcohol in pregnancy, we wouldn't have FASD. But there's a lot more factors that play into that. We don't know exactly how much alcohol results in FASD. We don't know how important the timing is, but we do know that it's necessary for the development of FASD. The disorder itself causes lots of difficulties for the children and adults who have the disorder, as well as their families, and requires a lot of public health funding and programs to help them achieve their greatest potential. So the Insight Mentoring Program is a 3-year intensive program offered to women who are pregnant or postpartum who have troubles with alcohol use and alcohol addictions. It's run by Healthy Child Manitoba, and what it does is the women are assigned a mentor, and the mentor helps them to set goals for themselves and their family to make healthier choices about their behaviors and to improve their health and well-being. Their goals often include a healthier relationship with any children that they currently have, include maybe reducing or stopping their use of alcohol and other substances. They may include use of contraception. They also include things like a steady income, a steady source of food, secure housing. The Insight program, when we examined its use using the data at the Manitoba Centre for Health Policy, confirmed a lot of findings that we knew about the participants in the program and gave us some new information. So one of the things that we know from other work in this area is that women who are at risk of having children with FASD and women who struggle with alcohol addiction have multiple barriers that they face when trying to change their health-related behaviors. They often started drinking at a very young age. They have a history of intimate partner violence, mental illness, poverty, and multiple other barriers within the system. And so it's not as simple as just choosing not to drink when pregnant. We learned that they weren't currently connected to the social services they needed, and that they had very high rates of alcohol and other substance use in pregnancy. When we looked at the women during the program and then after they left the program, we found out that the program was achieving its program goals. It helped the women to connect to the social services that they needed. It helped them reduce their alcohol use both inside and outside of pregnancy. And it helped them to use contraception if that was one of their goals. We also found that when we compared the women in the Insight program to another group of women with some similar challenges and similar alcohol use issues, that the women in the Insight program during the program itself accessed prenatal care at a higher rate and were better connected to other services. However, what we did find was that after they left the support of the program, they didn't achieve those same connections to prenatal care and to social services. So that tells us that the women who face these challenges need further ongoing support to attain their best health and well-being. Building on the results of the report, as I said before, I think it is important that we figure out whether the women would benefit from either an extension in the length of the program or a step-down program or a further support after the intensive mentoring that they get over the 3 years. Many of the women we think, we don't have the data yet, probably have FASD themselves, and therefore it's unrealistic to expect that they will continue to have these healthy behaviors without some sort of support.